Bismillahirrahmanirrahim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. O my Lord, open for me my chest and ease my task for me and make loose the knots from my tongue, that they may understand my speech. My dear esteemed brothers and colleagues, Assalamu alaikum wa rahmatullahi wa barakatuh. In addition to what Dr. Nadeem had to say about the general postural ergonomics in the morning previously, about the TMD podcast, in his podcast, I would like to add a couple of few things here. The postural ergonomics, in which the curvature in the cervical vertebra, when affected, has disastrous after effects, namely the BPPV, which is a benign positional paroxysmal vertigo. Let's not get into the BPPV, as it's a whole different level of discussion altogether. As rightly put by Dr. Nadeem, poor posture has a domino effect, as your misaligned spine will cause your lower jaw to protrude forward and create a bad bite, which is one of the leading causes of TMJ disorders after stress. Now, TMJ involves a host of problems that focus around the vital hinges that connects the lower and the upper jaw. The complex mix of muscles, connective tissue and nerves around these joints can affect every part of your body. When this joint is misaligned, strained or inflamed, it can wreak havoc on your body. While pain, swelling and discomfort in your jaw are the most obvious symptoms associated with the TM joint, you may also be experiencing chronic headaches, pain in your shoulders and a sore neck that won't go away. If you're having TMJ problems, it is almost certainly affecting your posture pain. The most obvious postural change is a forward head posture with rotation of the head on the first vertebra. Now, these affect radiating pains from your TMJ or surrounding structures can affect other parts of the body as well, such as your neck, shoulders, head or even lower back. As they struggle to cope, people often find themselves favoring one part of their body over the another. This is which creates an imbalance and is a very vicious cycle, contributing to the pain and compounding to the problem. The problem in itself can also be the inverse of the latter situation. For example, as we in general, what we do is we spend hours together at a desk peering at a computer or our smartphones, which can in turn strain your neck and jaw and also head. And also in certain situations, what we do is we generally tend to clench our jaw and tense our body due to stress, which can cause or even exacerbate this TMJ relations. The moment any part of your body is out of the alignment, negative consequences can begin. If you don't correct bad habits concerning our posture, our TMJ problems will also most likely worsen. One of the surgeons, Mr. Dr. Benham Birmingham, he is considered to be a pioneer in tempero-mandibular pain dysfunction. What he suggested was this facial arthromyalgia or the tempero-mandibular pain malfunction is a very common condition in which patients whine, involving soreness along with tenderness in one or even both tempero-mandibular joints, which is often limitations leading to the mouth openings. The condition is also 4 times more likely to be affecting the ladies in comparison to the males. With all due respect to the women folk in our forum, because this is again a wide range of reviews relating to the types of signs and symptoms to the damaging life events, anxiety or even the deficiency of psychological help because of the increased stress levels in one's life. This problem can occur individually as well as together with other non-muscular or non-joint pain in the face area, which in this then would be referred as atypical facial pain. Sometimes as well as the pain can just be related to the teeth, which is termed as atypical odontalgia. Now, unfortunately, this joint is a very common area for recurring pain. Although the conventional wisdom suggests that the popping sounds in the jaw indicates a TMJ dysfunction, this is not always true. Many a times our jaw is functioning properly even if a popping sound is present when chewing or talking. The actual cause of TMJ is still unknown, but I personally believe symptoms arise from problems with the muscles of the jaw or with the parts of the joint itself. Injury to the jaw, the joint, or the muscles of the head and neck, like from a heavy blow or whiplash, can also lead to TMJ. The other causes, such as the grinding, the clenching of the teeth, which put a lot of pressure on the joint, the movement of the soft disc between the ball socket of the joint, and also certain conditions such as arthritis of the joint itself can also exacerbate the underlying condition. Now, coming to the mechanism, coming to the mechanics of the temporomandibular joint function, when we bite down hard, we put a lot of force on the object between our teeth and the temporomandibular joint. In terms of physics, the jaw is the liver and the temporomandibular joint is the fulcrum. Actually, more force is applied per square foot to the joint surface than to whatever is between your teeth, because the cartilage between the bones provides a smooth surface over which the joint can freely slide with minimal friction. Therefore, the forces of chewing can be distributed over a wider surface in the joint space and minimize the risk of injury. In addition, several muscles contribute to opening and closing the jaw and aid in the function of the temporomandibular joint. Now that's about the mechanism of action. Moving ahead now with the causes and the damage following the chronic suffering of a patient with a temporomandibular dysfunction. What causes the TMJ pain? In majority of the patients, pain is associated with the TMJ is a result of displacement of the cartilage or the disc that causes the pressure and stretching of the associated sensory nerves. The popping or clicking occurs when the disc snaps into place when the jaw moves. In addition, the chewing muscles may spasm, not function efficiently, and cause pain and tenderness. Now further, what causes the damage to the temporomandibular joint is a point of concern, basically because we all know that major and minor trauma to the joint, teeth grinding, excessive gum chewing, stress and other psychological factors, improper bite improper bite or malpositioned jaws, arthritis, they are few of the contributing factors which lead to the damage in the temporomandibular joint itself. Now coming to the symptoms of the TMD, ear pain, sore jaw muscles, sometimes the pain in temple and cheek, jaw popping or clicking. Sometimes the dislocated joint also leads to damage of the entire joint in itself, and difficulty in opening and closing the mouth fully because of the spasm of the muscles, frequent head and neck aches, the pain which can be sharp and shearing, occurring each time you swallow, yawn or talk. It can be dull and it can be very constant, which is really very disturbing in the day-to-day life for an individual. It hurts over the joint, both or the or any individual TMJ which is affected can be tender, but pain can also radiate elsewhere. The radiating pain is often causes spasm in the adjacent muscles that are attached to the bones of the skull, face and jaws. Pain can be felt at the side of the head, the cheek, the lower jaw and the teeth. A very common focus of pain is in the ear. Many patients come to the ENT specialist quite convinced that their pain is from an ear infection. When the ear infection or when the ear ache is not associated with the hearing loss and the eardrum looks normal to an ENT, the attending ENT almost always considers the possibility of the pain coming from the temporomandibular joint. There are few other symptoms besides pain that TMJ can cause, like already previously discussed or previously told in my audio presentation, like popping, clicking or even grinding sounds. These grinding sounds can also be similar to the crepitus. If you keep your fingers over just in front of your tegus and then open and close your mouth, you might, in case you have a I apologize for the technical glitch due to which the audio presentation had to be discontinued abruptly. That was at one end, and the other extreme end, the TMJ can prevent the jaws from fully opening. It is because of the underlying muscular spasm, and some people are also known to get tinnitus or ringing in the ear from the TMJ because of this dysfunction. Moving ahead to the management of the TMD, a proper diagnosis of the joint in itself begins with a detailed history and physical, which includes careful assessment of the teeth, occlusion and function of the jaw joints and muscles. An early diagnosis will lead to the temporomandibular dysfunction likely responding to a simple and self remedies such as resting the muscles, avoiding chewing gums. We should avoid clenching or even tensing in situations of stress in day-to-day life. The relaxation of muscles can also be done with the use of moist heat fermentation, half an hour a day, twice daily. In case of joint injury, we can apply ice packs soon after the injury to reduce the swelling. The relaxation techniques and stress reduction protocol involving the patient education and sometimes the concomitant non-steroidal anti-inflammatory drugs with muscle relaxants or even other medications also offer relief to some extent. The treatment for advanced cases may include fabrication of an occlusal splint to prevent wear and tear of the joint, which I am not such a particular big fan of. And improving the alignment of the upper and the lower teeth also plays an important role in relieving the stress to the joint. And then finally, surgery. To address the query by Dr. Zahir regarding when to refer for the TMJ intervention, such as arthrocentesis and arthroscopy, I would like to mention the first difference between the arthrocentesis and the arthroscopy is the arthrocentesis is a blind procedure, and the arthroscopy is a procedure which is done using arthroscopes. The treatment of the tempero-mandibular joint in itself is very controversial, Dr. Zahir. Having said that, the first and foremost, the arthrocentesis represents a form of a minimally invasive surgical treatment, which is often the first surgical procedure that will be done for a patient who has a displaced disc or an internal derangement. It can be done as an in-office procedure. The procedure involves merely the placement of 2 hypodermic needles into the joint. When this is done with the hypodermic needles, we cannot visualize the joint, hence it's a blind procedure. Whereas when an arthroscope is used, we can appreciate the joint attachments and internal anatomy. The needles or the arthroscope are placed in the joint and it is flushed with a sterile saline solution or a lactated Ringer's solution. The purpose of this procedure is to remove tissue breakdown products and reduce inflammation. Generally, we also manipulate the jaw to remove scar tissue additions that may have formed. At the end of the procedure, we inject steroid into the joint. There's a difference of opinion regarding the injection of steroid from surgeon to surgeon, but I prefer injection of the steroids, which minimizes in the post-operative inflammation in the joint and the adjacent areas. There are generally no limitations or physical activity or the use of the jaw post-operatively, because I generally would recommend a jaw exercise program for the next 3 to 4 weeks and maintain a soft diet for some more time. Now, the TMJ arthroscopy was first performed in the early 1970s by a Japanese surgeon named Dr. Onishi. The primary indication of the arthroscopic surgery seems to be somewhat very limited. However, the value of endoscopic inspection and the surgery has its position for both the patient and the physician with its long-term reliable results. Compared to the arthrocentesis, which is emerging as an alternative, which is also less invasive in the treatment of internal derangements, multiple surgeons and physicians having had the differences of opinions, just like we had a couple of days back regarding the benefits of arthroscopy or arthrocentesis. Now, there was an American surgeon named Sanders who related that the arthroscopic lysis and lavage and arthrocentesis as first cousins. He stated that both have proven effectiveness and believed that the arthrocentesis would not have developed without the arthroscopy. Thus, the controversy was dissipated. Unlike our controversy, which had to be dissipated by the involvement of a lot of the members of the KMD group. Jokes apart, furthermore, I personally believe the level of involvement in the management of the tempero-mandibular dysfunction by us oral maxillofacial surgeons and dentists should not be minimal. And to conclude the audio presentation, lastly, in agreement with the Dr. Tajamul and slightly modifying his statement about the tug of war between the muscle and teeth, the muscle always wins, but at what cost? All of the cost is almost always at the cost of the TMJ. Rest assured, extensive treatment plans are not needed, but since the dysfunction in itself is so misunderstood, the treatment also and the treating doctors jump in to involve all the aspects in its management. Thank you so much. If you have any more further queries, please, I suggest my colleagues and then my contemporaries to add in and pitch in a few more of their opinions and then their experiences. Thank you so much.